this is just Amanda. Do you want to switch to your presentation? Thanks.
I don't have my presentation on. This is yours, I think. Oh, let me just check.
Because I think we're going to screen share, aren't we, for your presentation?
Yes.
The animations. Do you want to put yours up?
Let me just do that. Sure, it should be this one. It's a little confusing, but here we go. I can only test by going down. Yeah, let me just check. Yeah, that's mine. That's definitely mine. All right.
Okay, so apparently Denise has just messaged to say that we'll be starting with this particular slide for Claire. So do you want to move it back to the second slide?
Right. Now, hang on.
Control? Oh, no, Denise is in control. Denise, we're on slide 4 for some reason. Can it be put back to the welcome slide?
Yep, that's on the screen now.
Yes. Success. Well, thank you very much. Hello, everybody, and a warm welcome to PAI and to our webinar on making better policy. I hope you're all keeping safe and well. Very challenging times for us all. My name's Claire Cameron, and I'm one of PAI's directors. Some of you who may have joined previous webinars in the past will know that PAI, which is Public Administration International, is a London-based consultancy and training organisation, and we specialise in strengthening governance worldwide. Our webinar today is a short overview of how evidence can be used to inform and to help good policy making and decision making through its different stages. And I'm very pleased that our policy expert, Dr. Philip Davis, is here to talk you through and share his ideas and his very wide experience, both in the UK and widely internationally. So Phil is the workshop director for our own annual international workshops on policy analysis, using evidence, and policy impact and evaluation. So when Phil's finished his presentation, he'd be happy to take questions. And I think Amanda, my colleague, is going to explain how all the software works in a moment. But just to say again, thank you so much for joining us. We've got people from, well, all around the world, Caribbean, so good morning to you, from Europe and Africa and the Pacific and Asia. So it's sort of good morning, good afternoon, and good evening, I think, to everybody. And I hope you enjoy the webinar. Amanda, I'll hand to you, if I may, please, to just talk us through some of the software, logistics, and follow up. So okay. Thank you very much.
Thank you, Claire. So a warm welcome to everyone. So for our Better Policies webinar, just a quick run through of the software. On the left-hand side, you'll see that there is a questions box, a poll box, a chat box, and a handout box. If you have any questions for Professor Davies throughout the webinar, please use the question box to do this. We will be launching polls throughout the webinar, so we do ask that you participate when we launch those. The chat box we monitor, so please, by all means, talk amongst yourselves and with us as well. And with the handouts box, we will be sending out a recording of the webinar, some materials for this webinar as well, including the slide. Phil, I hand over to you.
Aha, right.
So
this is the dicey bit. Just give me a second.
So you want to do your screen share, I think.
Right, I thought I'd done that, but I hadn't. Yeah. Right. Allow. Oh, I need to do full screen. There we go. And there we go. Amanda, do you have the version?
I do indeed. So if you want to put that onto presenter view, we should be ready to go.
Right. Is that not on present? No, it's not. You're quite right.
There we go. Perfect.
I think I've just taken myself out of percentage view. Right. So, well, I hope everybody can hear me. That's the most important thing. It'd be nice if some of you can see me, but if not, the important thing is that you hear me. So my name is Phil Davis. I have been working with PAI for quite a few years now. My background basically is a mixture of being an academic, most of my life at Oxford University, but I've also been a senior civil servant in the UK government, working in the UK Cabinet Office, in the Prime Minister's Strategy Unit when Prime Minister Blair was our Prime Minister, and also working in Her Majesty's Treasury, which is our version of a finance ministry. So one of the things I've been doing in both of those lives is trying to make better policy. And that's what we're going to talk about today. And as Amanda said, there'll be times I want you to help me and to participate, which we will do through have a series of polls. And also, there is a chat function, which you've already been shown. If you have any questions during the presentation, just type them in, and I think Amanda or Denise will simply tell me that there is some questions coming through on the chat line. Amanda, I'm not getting the chat function or the poll function at the moment.
You won't do as you're in shared screen.
Right. So will you take care of the polls?
I will do, yes.
Right. Okay.
Don't worry about that.
Excuse us for doing our housekeeping. You get to see behind stage when we do things electronically. So let's start with what is policy. It may seem obvious what policy is. The meaning I'm going to use today is policy is the thing that links vision to the delivery of outcomes. Politicians are very good at the vision thing. We hope they are. They've got a vision how they want our country to be, or if it's more local, how our area wants to be. And often that's at quite a high level. It's not always the case. In fact, it's seldom the case that politicians drill down to how you're going to get that vision achieved, how you're going to deliver outcomes. So the first point is we're very much concerned with outcomes. It should be a key feature of policy. And the policy, as I say, links the vision of what our politicians want to it becoming a reality. Another way of putting it is it translates the political vision into specific programs, actions that deliver outcomes. And outcomes are desired changes in the real world. They're very citizen focused. So good policy, better policy, means things are getting better for the citizen. A number of policies are often needed when we're trying to achieve a bigger strategic outcome. And this is very important, is you can't afford to think just in silos. And we do. In every government I've worked with in the world, it's almost a feature of governments is that you think of the Department of Health, the Department of Education, the Department of Housing, Department of Welfare. That's how we organize government. But if you're trying to make life better for people on almost any dimension, you probably want health, education, welfare, and whatever to work together. Each of them will be having policies. So we need to keep that in mind, that good policy is joining up a lot of cross-cutting departments and agencies. We're going to come back to that point a little later. And these are some definitions that we had when I worked in the Prime Minister's Strategy Unit, actually a long time ago, though I went on for 3 or 4 more years after this. But it's still a document we're very proud of because it's the whole document's interesting. But these are just 3 approaches that we were trying to develop. So what we're going to cover is Better policy, if you want better policy, you've got to understand the problem you're dealing with. So we're going to look at that. And it's an in-depth understanding. Second, you better be engaging stakeholders and the right stakeholders. And engagement is the word here, and involvement, not just consultation. I want to come back to that point. Okay, so stakeholder engagement and involvement is very important. Thirdly, you need to be able to think about a range of options for achieving whatever it is the vision's trying to achieve. Okay, because it doesn't do detail. The vision says we want to reduce coronavirus, we want to grow the economy, we want to employ X number of thousand more people, whatever it is. You've got to think about different ways that that can be done. We call that being creative. Fourthly, and this is the evidence-based point, it's not a bad idea to think about what has worked elsewhere in other countries, in other jurisdictions, and particularly other jurisdictions that are similar to your own. So if you're a small island state, you might not want to be considering yourself as a comparator with the United Kingdom or the United States or Canada, but with other island states, and that's very important. We'll come back to that a little later. Then somebody has got to ask, and this is usually the job of senior policymakers, is how is a policy supposed to work? How is it supposed to work? What's the underlying logic? And again, that doesn't always get asked at the higher level that politicians work in. And one of the jobs as a senior civil servant is to get ministers and politicians to understand and to ask that question. We'll look a little bit at having a delivery plan. Basically, if you haven't got a delivery plan, guess what? You're not going to deliver. And good policy is policies that are delivered. There is a phrase in, somebody told me in Whitehall, which is where, of course, the London government, the British government is based, the civil service. And the phrase was, there are no bad policies, there is only bad implementation. Well, believe me, that's true to a certain extent. There are some very bad policies, but there are also good policies that don't become good because they don't get delivered and implemented properly. And lastly, we're going to look very briefly at you need some sort of effective monitoring and evaluation. You need to know in real time whether we're making a difference and whether that difference is positive or negative. Okay. So let us think about the policy process. People love to draw these little circles. Oh, that the world was as simple as this. I call it the ideal policy process. Maybe the idealistic policy process would be a better term. But there probably are 4 distinct stages. There's a stage where we're trying to understand the problem, the conceptual stage. And frankly, I don't think enough attention goes into that, as I'll try and show you. At that stage, you're asking, what is the problem in some considerable detail? Secondly, what if we did nothing? And also, what is the role of government? Because it's not always the case that government's going to be the solution to the problem. There may be somebody else, some other sector, the private sector, the voluntary sector, the international aid sector. So that's the first stage, thinking about the problem. Second, we then try and develop solutions. We develop our policies. And for here, we ask, have we generated a range of ideas? The problem here is it's very easy to get narrow, to get tunnel vision. Good policy making is to broaden your horizon, think outside the box, and then come back and narrow genuine policy options. And from that, we can learn, what has the rest of the world done? What have they done? Was it successful, and what made it successful? The third stage is where we put our policies into effect. We implement and deliver. And we have to ask, can we deliver well? And that's often the problem. The policy is great, but we don't have the right things in place for delivery. It can be infrastructure, it could be people, It can be finance. So we have to clarify who are our delivery partners and do they have the capacity and capability and money to do what's required. And the fourth stage is the more reflective monitoring and evaluation. What is the impact that we're having? Is it a positive impact? Because it may not be. Often with policies, we have negative impacts. We need to know that so we can do something about it. And what makes a policy effective? What needs to be in place is something we're going to look at. And also, what have we learned from the rollout of our policy? So you can see there are questions and evidence type questions at each stage in the policy process. So it's over to you now for a quick poll question. Which of the following factors do you think is most influential in making good policy? Is it the politics? Is it evidence? Or is it delivery issues? And let me help you with that. I'm going to show you another slide, then I'll come back to this question. So in the politics, it's about ideology, values, beliefs, the things that politicians argue over and get elected on. It's the realm of ministers and politicians. It's the realm of stakeholders. It is the realm of the public and citizens. Evidence is the science bit, the knowledge bit, the information bit, the data bit. What works? What do we know about what works? What do we know about getting an impact? What is feasible and what isn't feasible? And what is value for money? And by delivery, I mean, who are our delivery partners? Who's going to deliver this? Do they have the capacity? Do they have the capability? And are they motivated to deliver what we want to deliver? None of that can be taken for granted, but so often it is. So I'm going to go back now to the poll question. Excuse me. Amanda, have we the poll question up for our guests?
I have indeed. We have 13 people that have responded so far.
Yes.
So we have 15% on politics, 62% on evidence, and 23% on delivery issues.
Wow, that's really interesting. Yeah. Anybody else want to add to the poll before we close it?
And the poll will be open throughout. So if people want to vote after this poll, after this particular question, they can still do. So
and Amanda, can you
at
tell
the
me?
end.
I'm sorry, Amanda, can you tell me? Is there anything in the chat box?
At the minute, no, nothing. Just welcomes and hellos and everything like that. If anything major comes up, we'll let you know.
Exactly. So please, if you want to ask a question, make an observation, question me, just put it in the chat box and we'll pick it up and talk about it. So it looked as if it was first place went to delivery issues, second to evidence, and third was to politics. I'm really interested in that because, frankly, of course, all three matter. And often people say, oh, well, your evidence is okay, but it's the politics that drives it. And I'm delighted that people think that evidence might be even more important than politics, and that people recognize the importance of delivery issues. So that's a very interesting finding. Please, anybody who hasn't voted, think about it and let us know what you think. So if we go back to this slide here, what we're looking for, sorry, that last point, we're looking for what we call the sweet spot. It's where the politics, the evidence, and the delivery overlap. Where we can align those three major contributing factors is where we tend to get best policy. So you're never going to get rid of politics. That's what it's about. You're never going to get rid of ideas, ideology, values. And increasingly, in a modern digital world, you're not going to get rid of evidence. People are always talking about data, information. So they're going to come together. And that third component is crucial. Now, when they align in that special little bit, that sweet spot, that's what we're aiming for. We call it the policy Venn diagram for obvious features or obvious reasons. Okay, let me continue. I'll leave it to Amanda to interrupt if anything comes up in the chat box. I will stop at any time. So what are we doing with policy making? What are our goals? Well, there's probably dozens, but I think these are probably the most important we can discuss. First of all, I assume we want our goals, our policy to be effective, okay? By which I mean we want it to make a positive impact, to have a positive effect. Why do I say that? Because we know that often policies don't have a positive impact. They actually make things worse. Nobody designs it that way. Nobody goes out of the way to say, oh, let's see how we can make the citizens worse off. But somehow we manage to achieve it. And what we're trying to do with a more evidence-based approach is to change that, is to diminish the chance of making a negative effect and to increase the chance of a positive effect. So we're trying to be effective. I'm hoping we're agreed on that. Chat box is open. Secondly, we have to be efficient, which is not the same thing. Here we've got to use scarce public resources as efficiently as possible to get the maximum effect. To use the American phrase, to get the biggest bang for the buck. To use a more polite phrase, we're trying to get value for money. For every pound, dollar, euro, whatever your currency is, we're going to get the most effect. Thirdly, our goal should be to have effective implementation. We want to make sure we're implementing as well as we can. We've just gone through, we're all going through this at the moment with the implementation of the coronavirus vaccine. And people in the UK at the moment are jumping up with pride, and for once they've done something right. We're ahead of the game. We have implemented that pretty well. Other countries are having some other challenges. But it's crucial. It's not that we don't have a great vaccine, or we have actually half a dozen great vaccines now, but getting them rolled out, getting them implemented and delivered to the public is a real challenge. And even though in the UK we seem to be doing pretty well, there are still problems with particular groups, social groups, ethnic groups, people who don't believe in vaccination. So a goal of policy making should be to implement as effectively and as fully as we can. Fourth, I would call it adaptation. You need to know when you might have to change the policy in some respect. It may be a very minor change. It may be a major change. Sometimes policies are so badly not working, the government has to decide we've got to do something else. But typically it's tweaking, it's changing something about the delivery partner. It's giving more money to one area than to another. It's bringing forward a new infrastructural system, but you need to know when adaptation is necessary. Just waiting until, well, it'll be all right, in the end we'll get there. You could be 3 or 4 years into a policy and it's just been getting worse. Fifthly, we are, and I speak as a civil servant now, a former civil servant, we are in the service industry. We service the public. Prime Minister Blair once said, we serve the public, not the other way around. And that's very important to remember that. So we have to remember the service orientation. We are there to meet citizens' needs and their expectations, and their wants and all sorts of other things. And that's the point. They're not the same thing. What the citizens need and what they want may be very different. And I'm sure anybody who works in public policy is aware of that. So we need to have good information about what citizens need and how their needs are changing and what are the needs of different subgroups of our population. And sixthly, a good goal of policy should be accountability. Okay, we need to make sure that our policies are understood, they're transparent, they can be challenged through the parliamentary process, through the press, through the media. Now, some people say, that's not a policy goal, that's a political goal. Well, I would say that it's a very important element of policy, making our work as accountable and transparent as possible. Now, please, if you can think of some other goals, put them in the chat box, because there are many others. Some people say enhancing the democratic process. Some say increasing trust in government, which, let's face it, is sorely needed in many parts of the world. So that's maybe a discussion point. Were we together, we'd probably take a little break now and discuss that. But it's harder to do that when we're working digitally. So let's go back to the 6 things we're going to look at. Understanding the problem. We nowadays tend to call that situation analysis. I would think probably borrowed from the Situation Room that they have in the White House. And I noticed we're going to get a Situation Room at number 10 Downing Street. But the point is, we're trying to understand the situation fully. Why is that important? Because often we don't understand it fully. We understand it partially. We understand it from a particular point of view. So we need to know what exactly is the problem. What is its nature? What does it look like, taste like, smell like? Second, how big is it? Is it a small problem? Because often it is only a small problem or affecting a small degree of the population, and we blow it out of all proportion. Or the opposite happens. We don't think something's terribly important, and then it becomes enormous. I think most people made that mistake in the early hours and days and weeks of the coronavirus. We just assumed, nah, it's like a sort of flu. It'll be all right. And boy, were we wrong. Very quickly, its size became huge. And the rest, of course, is sadly history. Next question we ask in the situation analysis are, what are the consequences of a problem? Okay, for people, for communities, for the economy, for a whole range of things. Why is it a problem? Because it's actually having consequences for people and for different groups. So we try to tease out the whole range of consequences so we thoroughly understand the problem. Next, we ask, who does the problem affect and how? Again, in the jargon of analysis, and I am an analyst, I'm afraid, we call this distribution analysis. How is the problem distributed across a population? Okay, and I can tell you, it'll be different, differentially. Some people will barely be affected by a problem. Others, it overwhelms them, whether that's poverty, lack of access to clean water and sanitation, education, housing, crime, whatever we're working on, it's going to affect different groups differently. And we need to understand that distribution of the problem. And then we need to know what's driving the problem. Why do we have this problem? And that looks at the whole range of causal elements. And lastly, we often then ask, who is best placed to manage this problem? Goes back to what I was saying earlier. It may not be a problem for government, or it's a problem that government shares with the private sector, with the state, other parts of the state sector, with the voluntary sector, with religious groups, with ethnic groups. All sorts of people would be in a better position to respond to a problem than the government, or in collaboration with the government. We mustn't assume every problem for public policy has to be solved by government and government alone. I now want to illustrate that. We may have on the call 1 or 2 people from South Africa, in which case I welcome you. And I'm using South Africa because I've been privileged, and I really use that term meaningfully, privileged to work with the government, the federal and some of the provincial governments of South Africa over the last 10 years on these sorts of ideas and trying to put them into practice. And during my I think it says 2016. Yes, or it could be 2018. I don't have my glasses on. But in one of my trips to South Africa, we were discussing health issues. And I kept on hearing this statistic being rolled out. And I've highlighted it here. And it comes from an online news service in South Africa called News 24. And it rather unsubtly says that South Africa is the 3rd fattest nation in the world, according to a survey by pharmaceutical giants GlaxoSmithKline, but it was just the yellow bit there, the third fattest nation in the world. And we were beginning to have policy discussions about how to respond to this. And because I am a health scientist, I didn't think it was true. Something in the back of my head said, that's not right. One of the things we did actually was Africa Watch, which is a pressure group that goes to look at media representations of these sorts of claims throughout Africa. It challenged this and found, in fact, they talked to people at GlaxoSmithKline who said, we haven't done this survey. It's not one of ours. This is not a claim we're making. Somehow it had got into the public discourse based on this non-survey that South Africa was the third fattest nation in the world. So with my health analyst hat, I went to another source. I went to the World Health Organization, which I hope you would agree with me. In fact, we could have done a poll on this. I think you'd probably agree it's probably more reliable than a news station, however good News 24 is. If it was the BBC, I'd say the same, or South African broadcasting companies. I'm not picking on News 24. It's just that, you know, I think the World Health Organization probably has a more balanced and reliable estimate. And I won't bore you with it. There's a short quote there. The US comes in at number 19 in the world in terms of obesity. Mexico comes in at 33. And South Africa, according to the World Health Organization, is the 44th country, the country with the 44th country in the league tables of people who have internationally defined obesity. Okay? Very different from the top three. Now, I am not denying, we were not denying, that there is an obesity problem in South Africa. There's an obesity problem, as you can see, in many countries of the world. In fact, I've now put up the slide if you're interested. I've only run this to 2014, but you can see that the red is for women, the black is for male. Since the new South Africa, as I call it, the post-apartheid South Africa, slowly the number of people with obesity has been increasing. I'm not denying that. But what is interesting isn't just that or the numbers per se. Let's go to the next slide. It's who has obesity and overweight. And the distinction is simply overweight is if you have a body mass index of more than 25 and under 30. And obese is if you have a body mass index of over 30. They're two internationally recognized definitions of overweight and obesity. What I'm now going to circle two things. Well, one is the number of overweight women is much greater in South Africa than men, and the number of women, the obesity is much higher amongst women than men. Why is that an issue? Why does that matter? Because if we go to the OECD, the Organization of Economic Collaboration and Development, they tell us that the higher rate of obesity amongst women in South Africa is both interesting and part of the policy challenge, given that obesity rates in men and women in most parts of the world are similar. It's very unusual to have that degree of difference amongst women than men. So already we understand the problem more. We may want to target policies now more towards women than men, or we certainly may want to orient them in that way. And it's not just women, it's also children. The population group that is most vulnerable to this obesogenic, that means environment, the cause of obesity, is children. And this is a much more reliable source. The Heart and Stroke Association of South Africa estimated that girls who were obese between the ages of 4 and 6 were 42 times more likely to be obese as teenagers compared with their normal weight peers. So we now have two groups. We have to think about women and children, and within children, girls. It helps us focus where we need to be orienting our policies and finding out what is effective. Doesn't mean we exclude men or boys. It simply gives us a degree of focus and puts the obesity or overweight problem into some sort of organizational focus. I hope that's a helpful illustration of why we do that. So I'll just pause for a moment. Amanda, have there been any comments in the chat box?
At the moment, nothing.
Okay.
Let me just launch this poll.
Because we're going to go on to think about stakeholders. Remember I said earlier, getting stakeholders involved is very important. Put it the other way around, if you don't get the right stakeholders, you're probably not going to make good policy. So here's a question for you. Who would you involve in a stakeholder panel? If you're setting up a stakeholder panel, stakeholder involvement, who would you involve to help make better policy on childhood obesity? Let's focus it on that. And your 5 options are academics who research childhood obesity, people like me, pediatricians who treat childhood obesity, food industry executives, people who produce food for our supermarkets, our restaurants, our corner stores, the parents of children with obesity, or professional sportsmen and women. And you can have more than one vote. So I'd be very interested. Let's run the poll now, and I'll pause for a moment to see what the numbers are looking like.
So at the moment, we have 7% on academics who research childhood obesity.
Yep.
Got 60% on pediatricians who treat childhood obesity. We have
Was that 60?
60.
Thank you. Yep.
Okay, so we have 13% on food industry executives and 20% on parents of children with obesity. And so far, no votes on professional sportsmen and women.
Okay, fine. Right. Interesting distribution. Well, I'm very glad about the pediatricians because they clearly are a central feature. And I'm very pleased that 20% said parents with children with obesity. Why am I pleased with that? Because when we did a similar real-life stakeholder analysis way back 10 years ago when I was working in this issue in the UK, people said, why are we interested in the parents of obesity, of children with obesity? They couldn't, what would they contribute? They couldn't see that they are stakeholders. And they were put down as the low interest and low involvement. Okay, I think they're central. Okay, because they're going to know much more about the nature of the condition and its distribution. And let's face it, they've got to carry the burden of caring for them. Food industry executives, I'm sorry so few people thought that was to be included. And you of course, you voted, we should have given you a chance to vote more than once if you wanted to for different groups. But the reason why we put food industry executives is that they're the people who produce the food we eat. And the specific things we're interested in with obesity policy, particularly childhood obesity policy, is to minimize sugar, salt, and fat, and to maximize fiber in food. And that's not something you do in the kitchen, okay, because it's already in the products we buy. It's what comes out of the stores, the supermarkets. It's already in the food we eat. There is too much salt, too much sugar, too much fat, and too little fiber in many of the household things that children and adults eat. And we very much wanted them on board because you're not going to have a successful policy to deal with obesity unless you have the food industry involved. Okay? Very important. By the way, the food industry executives didn't want to be involved because they said, that's not our problem. Our problem is to get food on the table at a decent price that people like. They couldn't see they had any responsibility for obesity. Very interesting. Now, it's interesting you say nobody really voted for professional sportsmen and women because, again, to my surprise, they can play an important role in 2 dimensions. One is, of course, they themselves have to watch their weight and condition and know an awful lot about how to do that, but in a healthy way. Okay, though there is an argument that sometimes some sports people go so far they becomes unhealthy. So they are people who know about that, and they also know about the other side of obesity, not what you take in your food, okay, but how you exercise and how you burn it off. There's 2 dimensions to this problem. So they probably know an awful lot about exercise And some of them specialize in community exercise, how to get people in a community. So they do have a role to play, and I would want them in my stakeholder panel. And the other thing is they can become significant champions. They can become people that people look up to. So if a footballer or a 100-meter athlete is representing the importance of eating well and exercising well, it probably makes much more impact than if I did it, or if the Prime Minister did it, or even if the Queen or the President of your country did it. People tend to find, we find that on things to do with eating and exercise, sports people actually have a certain credibility. So the answer is you probably want all of them at some stage in the policy cycle. And that's the crucial thing we wanted to get over here. Sorry, over here at this point. So we're talking very much about stakeholder involvement and engagement, not just consultation. Consulting is a very passive, usually done when we said, this is our policy, this is what we're going to do. What do you think about it? Or we might say, do you think we could improve it? Stakeholder involvement, and this is for a completely separate day. We could spend a whole day on this. And in fact, on the course that we run, that is the extended version of this presentation, we actually spend a half day looking at stakeholder involvement. Okay, why is it important? Because stakeholders usually have localized, contextualized knowledge about the problem in hand. Okay, that you're never going to have in a centralized government unless you go and look for it. And we know that the things like eating and exercise varies incredibly from north to south, east to west of most countries. So you get localized knowledge. Second, it helps us clarify our objectives. What should we be aiming to achieve? What are the outcomes that not just we want as central policymakers, what do the people want? What counts as a good outcome for citizens? And part of it is also enjoying junk food. Interesting issue we have to deal with. Third, it gives us a real-world understanding of possible solutions. People are often influenced in their eating and their exercise habits by peers, by their culture, by their religion, by their ethnicity, by being rural as opposed to urban or urban as opposed to rural. Let's find out what works in the real world, and that's an evidence issue. Fourthly, it will give us support that we're going to need at the delivery stage. If you've got people locally who are going to be responsible for helping us deliver the policy, if they've had a stake, and that's what it means, they've got a stake in the problem, they also have a stake in the solution, they're probably going to be a lot more helpful than if we ignore them or treat them in a desultory way, in a very offhanded, light manner. Fifthly, you often find stakeholders, because of their contextualized, localized knowledge, know an awful lot about the barriers to something working and also what will make it work. And again, this is going to be variable across any country or island or region. And sixthly, we've shown in a number of studies where we've included and not included or involved stakeholders, you've got a better chance of being effective and you're going to have fewer policy failures. There is a really nice book called The Blunders of Government. I'm afraid it's about the blunders of British government, but it's a book really worthwhile reading by Ivor Crewe and David King. And again, I can cite it if you want to know about it. And it shows that this is a cross-party politics, that since the Second World War, 70 odd years, each government has made the same problems time and time again. They call them blunders. And one of the problems is they don't really involve stakeholders. They passively consult with them and often don't really take on board their interests and perspectives. So it's an interesting read, The Blunders of Government. There are second-hand copies, I can tell you, on Amazon for a significantly lower amount than if you bought it in the shop. So, last point on stakeholder involvement. What are we trying to do? What are the principles? One is to involve, don't just consult. We've mentioned that. And to sustain, get them in early at the planning stage and sustain it. Now, you'll use different stakeholders at different times. So we're going to have probably what we call a stakeholder panel. I'll come on to that in a minute. It has to be representative of people who've got different degrees of power and influence and different degrees of interest in the problem. We want it to be as inclusive as possible, and we know who gets excluded from stakeholder consultations. It tends to be, well, the homeless, the very elderly and the sick and disabled, people in prison, people who are marginal to society, the young we tend not to bring young people onto our stakeholder panels. So we do need to be more inclusive, and we need to have people from different ethnic groups and religions, because that's what inclusive means. It's good to review your stakeholders periodically. It might be that you've moved to a stage in the policy cycle that this stakeholder has less to offer, but somebody else has more. And that's what a stakeholder panel or review group is about. It can be a range of people. You can have 30 or 40 or 50 people. You don't do them all at the same time. You use them differently to make sure we're getting these advantages of stakeholder involvement. Okay, the third thing in the model about making better policy is to think broadly about policy options. Why? Well, because typically we tend to get tunnel visioned in the policy world, and we need to just open our eyes a little bit. So we need to clarify our objectives. We've mentioned that. Be creative. Involve stakeholders. We've mentioned that. Look at what's worked elsewhere. Don't become too insular. There's a technical way in which we score and weight options. I'm not going to deal with that today because it takes quite a bit of time. But there's a way in which you can prioritize your options and identify the best option, as the little signpost at the top here says. We need to know what is the best value for money. Many things are the best option, but they're far too expensive for the resources we've got. And it's always a good idea to consider doing nothing. It might be what we're already doing is effective, or it might be something the government shouldn't even try and do. Leave it to another sector or another body of people. So let's do another poll. Let's stay on our obesity issue. Which of the following policy options do you think is likely to be most effective at preventing obesity? So your first policy option is to have a junk food tax. What that is it taxes the junk that's in, we call it junk, the bad things. So it taxes sugar, if it's high in sugar, high in fat, if it's low in fiber, or if it's high in salt. It puts a tax on it, and it's been used across the world. We know quite a lot about it. Second, you could put a ban on television advertisements for junk foods, so you don't stimulate people to think, oh, we must go and buy that. Third, you could have a national information campaign about obesity, which might inform people about different foods and their consequences. So I'm asking you here, which do you think is the most effective? There's your three options. I'll give you a second to enter your poll. Amanda, are we getting any results?
We are indeed. At the moment, we have 17% on a junk food tax.
Mm-hmm.
We have 13% on a ban of TV ads for junk food. Mm-hmm. And at a whopping 70%, we have a national information campaign on obesity.
Good. Right. That's exactly what I'd expected. Because whenever we do this, the national information campaign always comes out massively in front. Okay? Unfortunately, it's the least effective way of preventing obesity. It's by the way, all three are important, but it is the least effective because we've now looked at all those countries that have relied on national information campaigns and compared it with those that have used the other and many other options. So let me show you, for instance, let me briefly explain what this is. And remember I said that we have a way of scoring and weighting options. So if you look at the top row, You can see third in, you've got option 1, junk food tax, option 2, ban on TV junk adverts, and 3, the national campaign. So we're comparing here 3 options. Let's look at the first column. And remember, our primary objective is to reduce obesity and its consequences. And this is also a good time to point out there are other objectives. We've got to think about reducing the economic costs of obesity, which are huge. Lost productivity, time off work, kids missing school, also cost to the health service. We've also got to make sure that people can still afford to eat. Okay, so you've got to avoid increases in household food budgets. Okay, we could tax the heck out of everything, but then people couldn't afford the other things. Or do we subsidize foods that are more healthy? Fourth, we've got to recognize that the food industry is an industry and it needs to be kept financially viable. We don't want to put them out of business. And fifthly, we want to have good, effective implementation. So when you do this sort of exercise, and it does take a bit of time, and this is one that I did quite recently, we asked people to rate what is the order of those objectives. And you can see the 5, 4, 3, 2, 1. They're all important objectives, but this says that the top one is to reduce obesity and its consequences. And then the rest, if you look at for each of the options, there's a basic score and a weighted score. Quite simply, the score is what do we know about the effectiveness of a policy for where we tested it. And you can see if you multiply that by the objective, 6 by 5 is 30. A weighted score is the balance between the importance of the objective and the effectiveness of the intervention. And if you look at the bottom line there, you can see that when you add it all up, junk food tax is way ahead of the other two in terms of being effective at reducing the combination of our objectives. Okay, it's by far the most effective. That's not to say you don't want to have a TV ban, perhaps, or a national information campaign, but they're simply less effective. And the other thing about the information campaign, they're often very effective for a few days or weeks, but they taper off very quickly, whereas a junk food tax tends to change people's behavior in the longer term. So I think it's a nice example where when we try to look at the evidence on this, the reverse order would be, it would be in the reverse order to the ones that our poll suggested. And indeed, that poll is always repeated whenever we do it. Okay.
Phil, just before you carry on, we've had an interesting comment pop up in the chat box from Brenda. She's saying, doesn't it take much more time to make policy if you have to do all the things you have suggested?
Yes, is the answer. Or it can do. If you did all things that we're talking about, it could do. But you could put it the other way around, and we've argued this many times in the UK government. Wouldn't it be better to do some things a bit slower and get more effectiveness, or perhaps do fewer things and get it right? So there's a balance to be had there. The other answer to that is it depends on what resources you've got. Now, in the UK, excuse me, I thought I'd turn this phone off. I'll have to just, I do apologize. In the UK, we have a very large and active research community in government. I know that many governments in the world don't have that. So this is about building analysis into the way in which we do government. And once you've got that operational, it actually turns out to be not that much longer time, and you actually get more effects of your policy. So whoever asked that, Brenda, I think is a good question. We don't want to dodge it. It may take extra time. What you have here is the detail doesn't matter. Is there are 13 policies here that have been proven to prevent obesity. 13, and some of them, if you did scan it, some of them are aimed at individuals, like information giving. Some of them are about changing their behaviors. Some of them are about changing the foods we eat. Some of them are about changing the way we farm. Some of them about using peers and local communities. There are different options there. Just that, by the way, is the top 13. I can probably come up with another 13 of effective options. So this is simply making the point that if you know where to look, you can find a range of options in order to do to make better policy. And the next slide is a resource slide for you to take away and interrogate. If you click on each of those URLs, these are all sources of evidence of what we know works in public policy and also what doesn't work. I can't go through them here. Again, we'll be doing this in a classroom together, and we do on our training course. We'd spend a session going through each of these so you can learn how to find out what works and what doesn't work across the world. The ones towards the bottom 4, are more oriented at low and middle income countries. But in fact, all of them have implications for low and middle income countries as well. But the last 4 are specifically focusing on LMICs. So please, when you get off this call, maybe you'd like to interrogate those and use them. If you are involved in policy making, use them going forward to find out effective and less effective mechanisms for making policy. So what does it mean when we say what works? People often say evidence-based policy is about doing what works. What do we mean by that? Well, we mean compared with doing something else. Or in fact, and a little put an arrow there to remind you and me, we're going to look at that slide in greater detail in the next slide. Okay? Or doing nothing at all. And that's the hardest thing for governments not to do things. Now, there's 2 versions of doing nothing at all. One is doing nothing at all. That's the hardest because nearly always governments got to do something, or you think they do. The softer version is simply don't do anything new. Just keep doing what we're already doing. Okay? And in some cases, if you give it time, it'll work. And that's called the business as usual case. You're probably familiar with that term if you work in policy. And to do this, we do what we call counterfactual analysis. That's what people like me do and analysts do. You don't want to sweat about it. We have people who do it for us, okay? And what counterfactual analysis simply means is estimating what would have happened without the policy. What if we didn't do something? Let me illustrate. Oh, for that, you've got to get a control group or a comparison group. And let me illustrate. So this is the policy I was involved with some time ago. We were trying to get people to stay in work when they came off welfare. So our outcome is, are we retaining people in work when they come off welfare? It's a big problem. Many people are in and out of work. They suffer what we call a low pay, no pay cycle. Now, this is the policy that we introduced in a particular country. And we monitored it over 5 years. We built in a monitoring system. And you can see this is the existing policy, the policy that was already being deployed by the government. And you can see that each year, more and more people were staying in work for more than 6 months was our outcome. They were staying in work, and that looks good. Yep, we're achieving. Now, this is what happened when we introduced our new policy, our policy option. And you can see that in every year, it got more people staying in work. It outperformed our existing policy. So we could have, I'll go back, we could have gone on doing what we were doing and it would have made an improvement. But by introducing another option, look at the difference. And the difference is this. It's a little red line there. It's the difference between the green and the cream. It is not the green. People say, oh, it's the green. No, the green is what we're going to get with the new policy. The cream is what we'd have got anyway. And that's what we call the net impact, which in this case is positive. And if any of you are economists would call the cream outcome the counterfactual or the dead weight. Okay, it's what you're going to get anyway. So when we say what works, we mean what works compared with doing something else. Now, this is positive. It can be negative. This is another policy I was involved with here in the UK. We were trying to help people with chronic sick and disability get into work and stay in work. Okay, it was another policy than the last one. Okay, and you can see that. So we had some people got the existing policy and some people got our policy option. And you can see this is measuring their weekly income post the intervention. And you can see that their incomes increased much more than those who received our new policy. In terms of their weekly income, it was a negative outcome, a negative impact. Would have been much better staying with the policy we already had. Look, that's the difference. So there we thought, we don't want to be pursuing our policy option. In fact, we had to do all sorts of different type of work, which we'll have to wait for another day to find out why. Why was this green policy not working? Because it had worked in other countries and other jurisdictions. And the answer was it had a lot to do with the implementation. But we're not doing that today. So bringing it towards the end now. I'm sorry, I have one other thing to consider. I don't know if people have heard of theory of change analysis. It sounds a bit of a mouthful. You might have heard of a logic model analysis, which is very similar. But what we need to know for better policy is, how is a policy supposed to work? What do I mean by that? I mean, what inputs have to be put in? What activities have got to be undertaken? Which people or agencies are going to do the doing of those activities? And what are the outputs that we're going to achieve in order to get our outcomes? And if you're wondering what the difference is between an output and outcome, consider the health service. If we produce more doctors and nurses and medicines, that's an increase in the output. It doesn't necessarily mean we're going to get a difference in outcome, which is people's health. If we were dealing with education, we could have more teachers, more books, more computers. These are outputs. It doesn't mean to say children are going to be learning better. So there's a very important distinction, which we'll worry about more on another day. So we need to know what inputs, activities, agencies, and outputs need to be in place. Second, in which order we try and build a causal chain. What has got to be here at what time before the next thing can happen? What data are required? We need data to find out how big those inputs have to be, how many activities have to be undertaken, how many agencies do we need, do they have the right resources? So again, it's a data issue. And often when we do a theory of change analysis, we find the things are not in place. We don't have the inputs ready. We are not ready to do the necessary activities. Therefore, somebody's got to call it. This policy is not ready to be rolled out. Is the policy option feasible? If not, do not roll it out unless, of course, there's immense political pressure, and there usually is in most policy situations. For each of those questions, we ask, what assumptions are we making? And the trouble with most policy making is we don't only make assumptions, we make heroic assumptions. I love this quote from Albert Einstein. Assumptions are made, and most assumptions are wrong. Absolutely. From over 40 years of working in public policy, I can't tell you how many times it's the assumptions that we make that are wrong. Test them. Test them with data, test them with evidence, and you often find you're going to get a very different picture. So another element is just taking this sort of analysis, theory of change analysis, about how a policy is supposed to work. And this is a slightly more complicated version of that. You start with the outcomes. What outputs do we need? Who's going to deliver them? What activities do they have to do to deliver the outputs? What inputs do we need? And inputs, by the way, are money, people, infrastructure, time, and there's probably others. And then we tend to start looking forward. How does that going to work? And why should it work? For each of those elements, we ask the how and the why questions. And just one other point about outcomes. These might be primary outcomes. Let's stay with education. If we can increase the educational outcomes of our children and adults, we're likely to get longer term economic impacts. They're called secondary outcomes. And we often call those secondary outcomes the impacts. The economy will grow, the GDP will increase, there'll be less violence, there'll be fewer crimes committed. We know that the more education people get, the healthier they get. So there are secondary outcomes as well. So we try and build this into our theory of change analysis about how a policy is going to work and what you're going to get from it. And remember, every one of those columns has to be, you have to question the assumptions that we're making. And we always make assumptions, and often they are heroically wrong. Sometimes they're right, but often we simply don't get it right. And that's why policies fail. So the last point is about a delivery plan. You need a delivery plan. If you ain't got one, you're not going to have delivery. And the three yellowy, creamy boxes there are what we've basically covered. You need to know something about the nature of the problem and what's causing it. You need to know something about what works. We're now thinking about what is your delivery chain going to look like and how are we going to respond to it? And that becomes a written delivery plan. Many countries, they call it an action plan. Some people call it an implementation plan. I don't care what you call it, as long as it's a plan, looking a bit like this. Now, I learned all this from somebody called Michael Barber, who was director of the Prime Minister's Delivery Unit, which was down the corridor from where I worked in the Prime Minister's Strategy Unit. And Michael has written an excellent book called Instruction to Deliver. It's a bit of an oldie now, but it's a very good book. And Michael is still working as a consultant on effective delivery. I'm not going to be his promo man, but he is very knowledgeable about these issues. And in this book, Instruction to Deliver, Michael makes the very simple point. If you can't draw the delivery chain, you can't deliver. And you need to think, we are servicing the citizens. They're at the bottom of this link. We in central government are at the top. Think of all the obstacles in between. As I said earlier, there are going to be other ministries involved. It's not just, education ministry isn't just about education. There's housing, transport, we've got to get kids to school safely, there's health. So there can be a problem with a secondary ministry, or is it an executive agency, or is it a regional government? Many of the countries on this call, you have 2 or 3, 4 tiers of government. So the provincial government may be working totally against the work of the federal government. That often happens, okay? And the front line are the people who deliver the services, the doctors, the nurses, the teachers, the people who do the work of delivering public services. These are all between a policy that we make in a central city like London or Washington or Toronto or Ottawa or Pretoria, and actually the citizens out there in the world. And 2 questions we need to ask: what links them? Or often, what doesn't link them? What is stopping them linking? Because that's where good policy becomes bad policy. And what is the relation between them? We often assume they're in harmonious togetherness. And my experience is that they're usually not. That they were. If we learn how to work much more collaboratively rather than in silos, the better. It's not just they're not joined up, they're often actively working against each other. And I'm not picking on any country. I would say in pretty much every country I've worked in, there is animosity or conflict or difficulty at some point between those different elements. And to put that a slightly different way, I want to ask you this poll question. Who in the delivery chain of a policy is best placed to know about its likely real-world effectiveness? Is it the minister responsible for the policy? Is it the senior civil servants advising the minister? Is it academics who research the policy issue? Or is it frontline staff who will deliver the policy? So you have 4 options there. Who is most likely to know about the real-world effectiveness? Please vote. Are we getting any votes, Amanda?
We are getting votes in. At the moment, we have 4% on the minister responsible for the policy.
Mm-hmm.
We have 8% on the senior civil servant advising the minister.
Mm-hmm.
We have 20% on academics who research the policy issue, and a whopping 68% on frontline staff who deliver the policy.
Which tells me we've got very intelligent people listening to this presentation today, because I think that's exactly the right distribution. And I'm not bad-mouthing ministers. I have the highest respect for them, regardless of their political party, and I have the highest regard for senior civil servants. You've got it right. The real world effectiveness is going to be our frontline staff. But please share with me if you disagree. But my experience is they're often the ones who get left out. We plan these policies in ministerial offices and civil servants' offices in our ministries. Okay, we might get some academic in from the university of whatever. Okay, and we forget that the people who are delivering healthcare, crime prevention, education, obesity prevention are often the most important. So thank you. I'm obviously preaching to the choir here, but let me just put this into another perspective. This comes from Michael Barber's book. Like everything I've said this afternoon or this morning, wherever you're listening to this, always start with outcomes. It's outcomes that affect citizens, not process. Well, process does as well, but it's outcomes we're trying to improve. And it's those frontline units who we've really got to make sure know what has to be done and tell us what has to be done. They shouldn't be passive recipients of a bright idea dreamt up in a ministry. They've got to be in the planning and the delivery process. So what's the job for ministries and our agencies? A very important one. It's to provide the vision thing. It's to establish priorities. It's to help with the planning, and that includes finding the resources, the cash, the priorities of expenditure reviews. It's to help build capacity. We have the right number of doctors, nurses, police people, and so forth. And to communicate what the government is much better done. If I
Dave, I think your camera has stopped working, as we've got you down as frozen at the moment.
Amanda, can you hear me?
I can hear you, Claire.
Amanda, can you hear me? Claire?
Can you, Claire? Can you hear me?
Yes, I can. Yes, I'm very sorry, everybody. If you're still connected, we've got hit a technical hitch, I think, haven't we?
We have indeed. I have posted a message in the chat
That's
box to
cool,
say
yeah.
that we're.
Our apologies.
reconnect.
I'm not sure if it's at Phil's end or presenter's end.
Claire, if you can hear me, I'm just going to try phoning him.
Yes, thank you. All right, let's do that. Please be patient with us for a little, because it's so interesting. I hope you'll be able to wait a little and that we can resolve the technical problem very soon. Thanks so much.
Thank you.
Hello again, Phil.
I got unceremoniously thrown out.
Yes, at least you're back on and we can hear you and see
Welcome,
you.
welcome back, Phil. Apologies to everybody about that interruption.
All I can think of is there's a huge electrical storm here in Oxford. I don't know if that made a difference.
It might have done.
But I had to go completely out. All our computers went down, so I do apologise. I hope there's still some folk out there. Are there some people still on the call?
We still have people on.
Right, we're just at the end, so I'll finish that. Then I want to get some questions going. So what I was going to show you here is from better outcomes, frontline staff. Yeah, that's what the central governments do, the ministries do. Then in the central government, as we call it here, the Prime Minister's office or the President's office, Cabinet office, Ministry of Finance, they are the people who, as it were, are the coordinating ministries and often drive the problem. So there is a job, there are different jobs for different sectors, but what I'm drawing attention to is do not forget those frontline staff. And I was delighted you identified them as being really important. Any of you who have done a project management course will have seen something like this, these are the things you need to have effective delivery of policy. I'm not going to go through them because that takes too much time, but you do need to have leadership, clear direction, an action plan, the available resources, good communication, well-motivated people who want to make a change, a realistic timetable, a monitoring setup so you know whether you're making progress or not, a risk register, and general project structures. Now, this also goes into the delivery plan. Were you on our 1-week course in London or online or wherever we do it, we will spend a little time going through each of these. But without knowing the answers to these yellow call-outs here, you're not going to have effective policy. And this is the last point. Monitoring and evaluation is important. It doesn't need to be too detailed or too technical. People make the mistake by thinking they should measure absolutely everything. No. If we were starting a policy today in 2021, and shall we say it's a 3-year policy, I would be planning a baseline where we're starting from. That's the left-hand side. And that's called ex ante at the beginning. I'd also say we're going to have a major review in 2024. That's the end line, though it may not be the end of the policy, it may continue. That's called the post hoc or ex post. And in the middle, we'd have a stock take called a midline or midterm review. So basically, it's just having 3 big data points where we're going to have a before, during, and after monitoring and evaluation. But throughout, we'd have the yellow running through here saying monitoring is we would have constant monitoring of what we need, what we're interested in. Now, that depends on what you're delivering. If it's education, you may only have annual results. If it's hospital waiting list, you'll be having them on a weekly basis, a monthly basis, or some cases, a daily basis. If it's crime statistics or the national productivity in the economy, they tend to get measured monthly and quarterly. But you need to build in definite milestones of when you're going to monitor what it is you're doing. And you need indicators. And this is my final point. In selecting indicators, please keep it simple. You don't need 125 indicators, 20 or 15 or 10 may do. The old principle, less is more, is very important here. Don't over egg the pudding, as it were. You need some indicators. Are your inputs in place? Are your activities being done? Are your agencies doing what they're supposed to be doing? Are you producing the outputs? And are we reducing the outcomes? Just imagine if you had 5 indicators for each. 1, 2, 3, 4, 5. You've got 20 indicators. And they should be indicators that inform decision making, that they are relevant, and they will help decision makers have the knowledge they need. Cut out all the others that are interested because we're trying to do a sociological or geographical or economic survey. That's not the essence of monitoring. It's to really help us make better decisions. We need a balance of qualitative and quantitative. That's very important. Always consider the data burden and the analysis burden. If you're going to have 120 indicators, and I've been there in some governments, who's going to analyze them? Do you know how much data that generates? And you've got what? 1 part-time person on a Wednesday afternoon? No. You need to, if you've got a huge analytical team, you might manage it. But if you've got a restricted analytical team, keep it simple. Keep it what you need to know to make good decisions. And I'm sure you're all familiar with the old management acronym about generally everything. Be smart. Your indicators should be specific, measurable, achievable, realistic, and time limited. And that's crucial. If you're guided by them, you're likely to have a good monitoring and evaluation set up. So to conclude, policy links vision to outcomes. It's outcomes that benefit citizens. Outputs don't necessarily. You can have all the doctors and all the nurses and all the medications, but if they're not properly organized and you don't get them delivered properly, you're not going to have healthier people. Find that sweet spot between politics, evidence, and delivery. Understand the problem thoroughly. Be creative. Don't get tunnel vision. Think outside the box. Use the freebie we've given you. Sources of where there is, evidence of effectiveness. Establish what works, as I say, and anticipate your planning issues, your delivery issues before rollout. Often I find people are thinking about the delivery issues after they've rolled the policy out. It's too late. It has to be beforehand. And if you can, build in a monitoring and evaluation process. That's me. Thank you very much for listening. I apologize we lost each other. That's the joys of doing things online and a huge electrical storm outside. I think that might have been the factor. Amanda, it's
yes
to see if there's any questions.
There are indeed. So the first question is from Patience, and it is: lobbyists play a big role in policy making in any country. How do they fit in with your approach to making a better policy?
Very good point. Well, in a sense, they're already there. They are part of the really the decision-making setup architecture, if you like, in nearly every government I've worked in, and they're very good. The trouble is they're often very good at giving the wrong message. or should I say, that's a little harsh perhaps, they're very good at giving a partial message. Okay, in other words, if they're a good lobbyist, they are lobbying on behalf of somebody, and there's nothing wrong with that in an open democratic society. It'd be nice if they were transparent, and they often are not. But lobbyists and pressure groups, they're right to represent particular groups, but because they're representing a particular perspective, they are by definition not representing other perspectives. And that's what we're trying to do by having that greater stakeholder involvement. Lobbyists are one of the family of stakeholders we want to involve, and they have to take their place amongst others, because otherwise you're going to get a distorted picture of the problem, of the possible solutions, and of the evidence of effectiveness. So they're there. We're not going to get rid of lobbyists. We're not going to get rid of pressure groups. I don't think we want to in an open democratic society, but we do need to be careful that they don't have too strong a voice.
Thank you, Phil. I have another 2 questions for you from Olorunje. Is there any way to develop a software for policy formulation and evaluation?
You're probably talking to the wrong person, because I think the answer is yes. I mean, there are, of course, certain algorithms that are developed. I don't know that they all always follow the most evidential approach. I mean, particular policies do have algorithms which they have to be. I mean, if you're organizing an exam system in schools, there is usually an algorithm that tells you what to do, for instance, with people who score margin on the margins, between an A, B, C, and a D, whether to go up or down. That sort of software already exists. It would be nice to ever ask that good question, to try and build this sort of process I'm talking about into a software model. And if you are a software engineer, please get in touch. You're probably talking to the wrong person, but and I think, with developments in artificial intelligence, that will be important. But there's a caveat. Good policy making requires judgment. I came to the civil service as a senior civil servant from academia. I was really, really impressed with the judgment of senior civil servants, the way they go about making judgments, the way they brought in experience, the way they bring expertise, the way they bring in something we call tacit knowledge. It's the knowledge you don't, tacit knowledge is about, you don't know how to ride a bike. You know how to ride a bike. You try and explain it, it's very hard. So what you probably wouldn't get with a software is that really important human element. So we want software, I think, can help us, but we must not lose the experience and the expertise of decision makers. Thank you for the question.
Okay, and the second question was, must the consent of all stakeholders in a matter be sought before policies are implemented?
No, you can't do that. That's, it would be lovely, wouldn't it? Arriving at a consensus is lovely. But, you can't be everything to all people. That's not what we're saying. What we want to do is to hear the voices. Now, sometimes we do get a consensus, and there's 2 versions of consensus. One is a majority, more than 51%, 50%, 51%. The other is where they all agree, which is very unusual. It would be nice if we could get the majority of stakeholders on the same page. But I'm realistic enough, and I've been around long enough to know that that's not always going to happen. Where it does, we're in a win-win situation. What we must do, though, is make sure that the voices of people who are in the 4%, 5%, who are they? Homeless people, I say again, people in prison, particularly people in prison who are coming out of prison, the very elderly, the young, people who don't speak as a first language the language of your country, okay? People for whom in Britain, England would be a second, third, or fourth language. You've got to hear those voices. Ultimately, somebody has to make a decision. That's the minister. But the minister would be in a much better position if he or she knew that there's more than what we call the usual suspects. The trouble with a lot of the stakeholder work we do, it's the same old suspects always get their voice over and the others don't. But you can't have people, you can't base policy by everybody agreeing all the time. It just doesn't work. Any other questions?
Yes, we have one more question, Phil. And this is from Brenda. And she is saying, it sounds like you need a lot of research and analysis in your approach to policy making. We don't have this in my country. How do you suggest we deal with this?
Yeah, this is because I'm really lucky, and partly through PAI, I do a lot of work in many countries. The ones represented here, a lot of work in the Caribbean, in the Africas, in India. Recently, we've been doing some work at the other extreme in the country of Georgia, and we're doing some work at the moment in Turkey. I could go on. So I know that in some areas they are simply, you don't have government analysts, or if you do, it's somebody who's, there's a few statisticians maybe work mainly in the management of administrative data. Now, if you don't have that, I mean, one of the messages is we need to build that. Okay, any successful company does have people who do the analytical work. Governments need analysts. And I'll tell you who they are. They're statisticians, and you've probably got those in your National Statistics Office or National Statistics Bureau. You need economists. You need social researchers, people who do the sociology, the cultural anthropology sort of work. And you need something called operational analysts, which I find outside the UK and maybe the US, Canada, you don't have them very often. Operational analysts are people who do the operations. They do the delivery stuff. They do the breaking down of a policy into its delivery components. And they're brilliant. So if you haven't got them, lesson number one is I strongly suggest governments across the world should be building analytical capacity. Otherwise, you're making policy blind. And if you can't afford to do that, or if you don't have the person power to do it, that's where our universities, our think tanks, our research groups and agencies, and our private sector companies can come into play. We can commission some of this work out. I happen to think very strongly you need a strong in-government analytical force, okay? In the ultimate, it pays for itself. But we do have universities on, if not on an island or a country basis, we have them on a regional basis. The University of the West Indies, for instance, does lots of really interesting work for all of the islands of the countries of the Caribbean and further afield. And there are universities in the bigger countries. If you have your big, in South Africa, we have some of the finest universities in the world, and in India, or you're close to the US or to Canada, or to Europe or Britain specifically. Universities often have this capacity, and some universities specialize in having evidence-based, as it were, think tanks. There's one at the London School of Economics I'm very fond of. I better not mention it because they'll get too big-headed, but they really are good. They are as good as you're going to get, and they happen to be just down the road from Whitehall, where we make policy. So I welcome that point because it's a big issue. So many people don't have analytical capacity. We've simply got to build it. It's part of making better policy, which is what this presentation has been about.
Thank you, Phil. That was all of the questions that we had.
Amanda, thank you very much. This is Claire back again. Let me just put my camera on. Right, hello again.
Yeah.
In fact, I spotted two more questions, but because of the time has gone on a little bit long, maybe if those two colleagues are willing, Delene and Matsidiso, we could ask you, Phil, to reply to them after the session.
I'm happy to do so.
Both interesting, very, very good questions. One about policy failure. So, yeah. So may I just say a big thank you, Phil. Thank you very, very much. I mean, you got a very, very good discussion going. and took us through some really interesting points with plenty of illustrations, such as the obesity case, which provoked a lot of chat in the chat room. So a good example. You'll see in front of you that we've got a little information about the policy workshops that you run with us. One coming up in November in Dubai, and another strategy into policy workshop in November in London, hopefully, but if not virtually. And another of our free webinars coming up on the 27th of May. So please do sign up for that if you're interested. So just to say thank you so much again. Thank you all for joining us and for your excellent collaboration and participation. And we'll keep in touch. Keep an eye on our website, and my colleague Denise will be emailing you from time to time with news and events coming up. And I hope you will keep all very safe and well, and that we will get to meet before too long. That would be a great pleasure. But in the meantime, thanks so much again, and thank you again, Phil. Thanks, Denise and Amanda. All right, take care. Bye-bye, everybody.
Just a quick one before everyone logs off. We do have a short evaluation at the end of this webinar, so it would be very much appreciated if you could fill that in. Thank you.
Looking at the chat, it's interesting. So, good presentation, rich materials. Please allow me with a copy of the material certificate. Yeah, we can do that. Many thanks. Again. I'm looking for those two questions that you mentioned.
Let's see if we can find.
They're found anyway.
Yeah, they may actually. I don't think they're in the question box. Ah, here we go. They're in the question box right at the bottom.
The question box right at the bottom. Oh, hang on. That's questions. Yeah. Well, I've got Raquel Hall. Thank you, Amanda.
So do you want to go if you go into the questions box, Phil? It should be.
I click on. I'm sorry, I'm in the wrong box. Right. Yeah, glasses might help as well. Machidiso, what are some of the things that can make good policies fail? Well, all the things I mentioned, but I could. Yeah, okay, I'll answer that. Patience, delinquent patience. I agree regarding lobbyists. However, I think that the question should be asked whether what they are asking for is what they need. In other words, what is the best for the citizen affected? Right. It sounds like, yeah, okay. Patience. Should I reply here?
You can do, Phil.
Yeah, I agree with regard. However, I think that the question should be asked whether they are asking for is what they need.
I mean, if you don't want to do that now, Phil, you can actually. We do have everyone's contact details, so if you want to do it via email a bit later, you can.
That might be better if you can get them for Deline Clark with that question.
Yeah, that's no problem at all.
And if you can get it for Machidiso Bokole with that question, send it to me and I'll send them an email.
Yeah, perfect.
Yeah, the polls worked well, I thought. Yeah.
Okay. Just to let you know, Phil, that everyone's still online.
Okay, good. Well, maybe I could talk to them.
You can do if you want to.
Yeah. Let me go to questions. Is Delaney still online? Or is it Delenn?
If you go under people, you should be able to see. I'm just going to Cleaver.
I'm not as familiar. Right, how do I know if they're online? Oh, I see. If they're there, they're online. So Deline isn't, but Machidiso is. Machidiso, if I pronounce it correctly, Machidiso, are you still there? Hello? Maybe not. I'm happy to speak with you, Mercedes.
She is still online, Phil. She's in the chat box.
Oh, I see. Right. So okay. Well, I think the best thing to do is, as you say, download the questions, and I'll give a. If you send it to me by email, I'll do it in an email back to them.
Okay, that's perfect.
Yeah. Right.
Okay. So I'm going to now switch off my mic and leave the presentation,
Yep.
and I will speak to you later.
Yeah, I think we'll have a post-mortem. Okay. Okay. Talk to you later.